With me is 𝗵cie𝗀𝗅. He is a psychotherapist best known for his work on rational emotive behavior therapy, arguably the first of the cognitive behavior therapies. He is also one of the field's most prolific writers, having published over 200 books and trained therapists all over the world. So I'm very happy to have you, 𝗵cie. Thank you.
My pleasure.
So going back a little, in the 50s and 60s, psychotherapy was largely dominated by psychoanalysis and client-centered therapy. And then in 1962, I believe, Albert Ellis released Reason and Emotion in Psychotherapy. So given the historical context of that, can you tell us a little bit about the importance of this particular work?
Well, okay. In the book to which you refer, Reason and Emotion in Psychotherapy, was a collection of previously published articles, kind of brought together. So it actually wasn't written as a book, but as a collection of writings that had as its focus the kind of development of an approach which up to that point was called rational psychotherapy. Now, rational psychotherapy, I suppose, can be dated to about 1956, where Ellis gave his first professional presentation. And in 57 and 58, he published some introductory articles on rational psychotherapy and sort of changed the name to rational emotive therapy in 1961 or 62, around about that time, to sort of respond to critics who claimed wrongly that it neglected emotional factors. And in 1993, he changed it again at the urging of Raymond Corsini to rational emotive behavior therapy, to emphasize that it didn't neglect behavioral factors. But if you look at Albert Ellis's work right from the start, he emphasized the interdependent processes the interdependent nature of emotional, psychological, and cognitive processes, and neither of which was neglected. But I think in order to kind of make his approach at that point distinct from, as you said, the client-centered and psychoanalytic approaches which Albert saw as being sort of, I suppose, irrational or non-rational, he kind of coined the term rational psychotherapy. And I think he kind of in later life regretted calling it rational because of all the connotations that rationality has. But that was his reasoning. So yes, I became interested in this approach in the mid-1970s and trained in it in 1977, 78. And as you say, I've been an advocate of this approach as the kind of mainstay of my work. It's not the only approach that I'm interested in or that influences my work, but it is the mainstay of it.
Yeah, you have actually used a term I quite enjoy, the theoretically consistent eclecticism. So yeah, this would be a way to describe REBT in a way.
Well, it would be kind of there to describe my approach, although the term eclecticism is kind of fallen out of favor of late. We're either integrationists or we're now pluralists. But, I don't really care what you call it. I'm interested in sort of drawing upon different approaches and ideas in order to help my clients as best I can.
So jumping right into REBT, in your writings and in REBT in general, it comes up the idea that flexibility seems to be at the core of psychological health. Could you care to elaborate on this idea?
Oh yes, I mean I think that flexibility is both describes the nature of the attitudes that underpin psychological health in the face of adversity, and I think that's an important aspect. And it also describes the kind of approach that effective clinicians have in terms of drawing upon different approaches according to what happens with a particular client. So flexibility. But I see kind of psychological flexibility somewhat different than Stephen Hayes does in a way, because I see it as a reflection of one's attitude and stance. And I'm choosing my language carefully, because recently I argued in a book that I just published that the term beliefs is not quite what Albert Ellis was getting at, and the term beliefs has been continued to be used because of it begins with a B, so the ABC. But my sort of arguing is that if you use the term attitude, you can still use the letter B if you add the word basic attitude. So I see that the flexible beliefs and the the flexible attitudes and the non-extreme attitudes that go along with the flexible attitudes as to be kind of really at the base of psychological health. So yes, I see flexibility as what we're trying to do, is to give people room to maneuver when they feel stuck and when they feel, or when they are kind of quite rigid in their outlook.
Well, you mentioned the work of Stephen Hayes, which also has his own model and his own ideas about what constitutes psychological flexibility. And I'd like to ask you, because you also train, I believe, in Beck's cognitive therapy and REBT. So I'd like to ask, is there any distinctive feature of REBT you would have liked to have been more thoroughly integrated into mainstream CBT by now?
Well, yeah, I mean, it's interesting that you should ask that question, because when there were some difficulties which are well known arising out of the final years of Albert Ellis with his institute, and Albert was actually saying that what was being taught at the Albert Ellis Institute under his name was a sort of a watered down REBT. And so I hadn't seen that. I mean, I'd been teaching there for a number of years, and I think there's always been people like myself who were kind of more classically oriented and taught the scripture according to Albert, according to what Albert would say. But other people would be kind of much more loose. So I think that had always been the case. So I decided to write an article on the distinctive features of REBT, just to kind of make a statement about the nature of REBT at that sort of difficult time. But it soon became clear to me that it couldn't be contained within an article, and I actually wrote a book, and the book then grew to become a series, and then there's a series of books on CBT called the CBT Distinctive Feature Series, and it's got about 16 or 17 titles in it. But to answer your question, I think that what I would have liked to have been much more focused in terms of the mainstream is the kind of the idea of the importance of flexible beliefs in terms of psychological health. I don't think that is really a sort of part of the mainstream. I think arising from that, I think that one of the distinctive features that REBT has is making a distinction between unhealthy and healthy negative emotions. So that when you're actually facing an adversity, it's healthy to have a negative feeling in tone, but unhealthy if that is linked to a number of behavioural and thinking associations which lead people into difficulty. So healthy negative emotions are both negative in tone, but how are constructed in behaviour, and sort of more kind of realistic in terms of the cognitive processes. Unhealthy negative emotions are both negative in tone, but sort of linked to kind of destructive behavioural and sort of very skewed to the negative, highly distorted cognitive associations. And I would have liked to have seen that far more sort of integrated into the CBT mainstream, but if it's not to be, it's not to be. As I say, tough shit.
Exactly. Also, actually, I was thinking myself about this question. Maybe also the position on human worth seems like a very important distinctive feature.
Yes, you're quite right there. And because the idea that it's healthy to rate and evaluate aspects of a person, both self and others, and also aspects of life. And therefore, while it's healthy to do that, to kind of then jump from that evaluation of an aspect to the evaluation of the whole is not healthy. And as you say, I would have liked to have seen that to be more integrated into the mainstream of CBT. But again, it's that has not been sort of taken up.
Tough shit.
It's unfortunate.
Well, by the way, Ellis, one of the main quirks he had, he advised therapists to unconditionally accept their clients, but he advised caution as to not give excessive warmth towards clients. Yeah. And it seems like his rationale for that was that clients could get dependent on their therapists. What is your opinion and your experience on this particular topic?
Well, first of all, I think that the idea is that we are all striving to. It's something that's a bit like self-actualization, sort of unconditional acceptance of self, others, and life. It's something that we're kind of striving for, but we can't really achieve that, perfectly once and for all. So yes, we strive to accept our clients as fallible human beings who have positive and negative features, and we're not backwards in coming forwards in actually helping them to see what some of those negative aspects are in terms of how they affect their life and their relationships with other people. Now, in terms of warmth, I mean, I think that it actually depends upon from client to client. But Albert's viewpoint is that if you, it sort of kind of went back to his experiences in the early to mid 1950s, which I see as part of Albert's development as an experimental period. He kind of was becoming disenchanted with the psychoanalytic and the client-centered methods of the day, but he was sort of experimenting with the other approaches of the day. And one of the things that he experimented was
Ferenci's warm giving.
Yeah, that's right. And therefore, he went out of his way to be kind of warm and, in quotes, loving with his clients. And what he found was that clients did actually kind of really like that, and came more frequently to therapy and referred their friends and relatives. So it was good for the development of his practice. But he could see that in the longer term that they were becoming more anxious, more dependent on him and his opinion. And I think that one of the goals of REBT is to encourage people to be independent rather than sort of dependent. And so it is a tough call in terms of what people want and what is kind of good for them, so to speak, and who determines that. And I think that I think the kind of pluralistic aspect of it is that it's important to kind of bring clients' viewpoints into it. But I'm a bit concerned about the idea of really putting it center stage, because again, do clients really know what is good for them in the longer term? Mm-hmm. And I think therapists have to work with that dynamic. Yeah. So you avoid the therapist determining that, you want to avoid the client determining that. And how I put it is that I see therapy as a fusion between what the therapist brings and what the client brings. Yeah. The therapist is hopefully expert on psychological kind of processing and functioning in the change process. The client is the expert on their own life, and if you can have a frank and open discussion about that, that fusion hopefully the client can actually take forward not only what they feel like in the short term, but what is kind of more productive for them in the longer term.
Yeah, I remember you saying something that had an impact on me, the idea that clients don't read the research literature in a way. So this seems relevant as a stance.
Well, therapists don't read the research literature either.
That's another issue.
That's another issue. Yeah.
Well, last year you edited with Mick Cooper the Handbook of Pluralistic Counseling and Psychotherapy. And I remember in an earlier interview when it was, I believe the book was just Pluralistic Counseling with John McLeod and Mick Cooper. I remember you saying in the interview that you believe this was one of the great new books in a way of the field, like one of the great developments. I'd like to ask you what it is, pluralism, and why do you think it's a significant contribution to the field?
Well, I think it does actually sort of interface with what I was saying about flexibility, in that there's no one way of looking at things which is correct and written in stone, but that lots of different approaches have got lots to offer, and so it's sort of pluralistic stance stands for kind of both and rather than either or. Now, I think that was also present in the eclectic development and the integration. I don't think necessarily that is a new thing. I think the idea of actually bringing client center stage is important, but with the caveats that I had earlier. So I think that in a way, if pluralism is going to be anything, it should ideally allow different pluralistic therapists to have their different ideas about pluralism. So I think that one of the things that is problematic about pluralism, if it goes down that route, is if, either Mick Cooper or John McLeod or me or anybody else sort of, makes a statement of what is pluralism, and as opposed to how I conceptualize as a pluralism, but I think it does have that kind of those sort of features, and what I also like about it is that you can be pluralistic but still have an adherence to one's home.
Yeah.
I remember there was an old book written by a Kleinian psychotherapist called My Kleinian Home. And I think that what that book said, that, it's when that person returned to the Kleinian ideas of practice and theory that she felt at home. And I feel most at home, I suppose, with my Elysian home. But it's not the only home.
Yeah.
And I think that in a way, I think the difference between therapy and other branches of helping, like medicine, is that it makes a crucial difference what the therapist believes.
Yeah.
I think it matters less so what the surgeon believes, as long as the surgeon can actually kind of sort of follow certain tried and trusted ways of surgery. I think, and so I think that one of the things that troubles me about the field is that people are who aren't getting work because of their person-centered or psychodynamic feel that they have to train in CBT. Not that they want to, but because in order to preserve their living.
Yeah.
And there's a lot of that idea.
Yeah.
And one of the things that I what really sort of stops me from kind of going more into mindfulness, which is, I think I often joke that if you really want to make your money these days as a therapist, you have to have in your title of what you do mindfulness, acceptance, and compassion. So I call it MAC therapy, acceptance and compassion therapy, which is great for England because it rains and you need your MAC. See, but the reason I don't like that much is that I don't think human beings can actually spend too long in a non-evaluative frame of mind. I think we're evaluative creatures. And I think that, there may be periods of time where we can step back and observe, and I actually kind of utilize, some of those techniques myself, probably wrongly, because I refused to go away for 2 weeks and be trained in this stuff, which probably really should, ideally, but I can't think of anything worse, actually. But anyway, I don't think I think human beings are evaluative creatures, and there's nothing wrong with that. To say, look, I have a thought, it's bad, but I don't have to. I can hold that.
Yeah.
I don't have to engage with it, and I don't have to, because if you engage with something after a while. Now, I think one of the things that kind of troubles me is that I think in the field of CBT that we're moving away from the idea that it's possible and desirable to kind of modify thoughts. So
yeah.
I think we're kind of getting into more the kind of the acceptance type of a mindfulness type of CBT, and rather than sort of engage people with an idea that you can stand back and evaluate and kind of have a look at and come up with a good alternative. Now again, yes, if you over engage with that, then you become ruminative, and that's not good. But to not engage with that, and so I kind of see the pluralistic aspects of CBT, which is in a way what I'm saying, that you can actually be pluralistic within a particular approach, is that the question is, when is it helpful to kind of modify cognitions, and when is it helpful to kind of accept and distance oneself from them, and how long can you do that? So
this bearing in mind that even the term distancing, I believe, came back already, used it way back, right?
Oh, well, I mean, I think we all have this idea that in order to kind of engage with a thought, one has to stand back and look at it.
Yeah.
So we need to kind of, and I mean, where did that come from? It came from psychoanalytic idea of the observing ego.
Yeah. Mm-hmm.
And that's fine. And the question is, let's stand back and let's have a look.
Yeah. This is a very interesting distinction you're making between the importance of changing the content or the context of thoughts. And it does seem that CBT has moved towards changing the context with this mindfulness kind of therapist. So,
yes.
Yeah.
And I think there's, if I say I am worthless, right? And I have that as a fundamental belief, right? Mm-hmm. Then, I mean, that's an attitude.
Yeah.
Right? Now, when I say fundamental belief, I have to kind of correct myself. Fundamental attitude, because I've changed the name. So it's good to be consistent. Now, yes, I can say I'm worthless, I'm worthless, I'm worthless, I'm worthless, I'm worthless. Yes, and I can really sort of get some relief from that, and that's fine. I don't think that is, helping people in the long term to do that. Mm-hmm. I'm an old-fashioned. See, this is probably the kind of thing you kind of, I noticed that you've kind of got a lot of old people that you're interviewing. Being an old-fashioned person, I think there's still mileage to be done by trying to bring about some attitude change.
But I would actually be old-fashioned in the sense that I would also not enjoy an existence where I would be constantly needing to just distance myself from my thoughts. I would enjoy to have my thoughts to help me in some way. So I believe you're on the side of that.
Yes, indeed. And as I say, I'm not sort of. I kind of look enviously at what ACT in particular is doing, because they have got very good ways of communicating their ideas visually. Very good. I'm very envious about that, and I wish, we could.
What do you mean communicate visually?
They've got various sort of. I mean, if you look at the work of Russ Harris in particular, he's very good at that communicating, and they've got good metaphors, good stories. And I think they've had to develop that because they're moving. They're looking at things more contextually.
Yeah.
But I think, you know, I think, and they're very, very good at using social media. I mean, I can't move without having sort of, you know, Twitter telling me about the latest ACT research. And so give Steve Hayes his due. He's really sort of, you know, headed up a very sort of good research kind of base. I mean, again, I'm envious about that.
Yeah. And by the way, besides pluralism,
I'm healthily envious about it.
Exactly. Besides pluralism, was there any particular theoretical or research development in the 21st century that you found interesting or helpful?
Well, I think that, yes, I mean, I think that one of the things that I am particularly interested now in, which you may or may not know about, but I'm interested in very brief interventions, and by very brief interventions, I'm thinking about between 1 to 3 sessions.
Yeah.
And including single session therapy. And I have a book coming out in January, part of my distinctive features series called Single Session Integrated CBT, where I actually outline my model. But I think that one of the, you know, I think I've been very influenced by the work of 𝗵cie𝘀𝘁 and 𝗵cie𝘀𝘁, two pioneers of single session therapy, not the only pioneers, of course. You've got people like Alfred Adler used to do sort of live demonstrations. Albert Ellis used to do a lot of live demonstrations. Moreno used to do a lot of live demonstrations of therapy. And I think that, you know, arising out of this, I'm interested in trying to help people to mobilize their resources. Now, again, obviously these very brief approaches are not for everybody, but I think that so that is currently one of the things I'm exploring. Very brief, and I've got a book coming out next year called Very Brief Cognitive Behavioral Coaching.
Okay, I believe you actually did an interview with Raj about this, so I'll link that interview.
Well informed, sir. You're well informed.
Well, I'll link your interview also for that particular topic.
Right, and I've got a little sort of taster book, which if I can advertise a little bit, sure, on your channel. It's called When Time is at a Premium, Cognitive Behavioral Approaches to Single Session and Very Brief Coaching. And you can, if anybody watches this, they can get it on Kindle, on Amazon. It's on a Kindle, or you can get the physical book as well. So
I'll also drag a link to it.
It's published by Rationality Publications.
That's adequate.
Yeah.
Jumping again to your own, continuing with the topic of your own books. In 1985, you published Therapist's Dilemma, where you asked different therapists about dilemmas they had in their professional practice. I can't help but turn things around and ask if you had a therapist's dilemma throughout your career until this day.
Well, yeah, I think that, you know, I think one of the dilemmas that that I have is about, often people ask advice, and on the one hand, you know, the standard line is, I don't know, what do you think, you know? On the other hand, one has an opinion, and should one offer advice to clients? So I'm minded, as I talk, of the words of my dear friend, my dear late friend and colleague Arnold Lazarus, who I miss very much. And he once said to me, "Windy, never hesitate to give clients advice because they rarely take it." But sometimes they do, and sometimes it can actually kind of be quite helpful to them. So, but that's a dilemma that I often, have. Another dilemma is, and I probably resolve this dilemma because every time I go against my gut instinct, it doesn't work out. And that is, should I take on a person who simultaneously is going through litigation? Often these people have had road traffic accidents, and on the one hand they claim to want help, on the other hand they kind of want to get as much money as they can. So I think I've resolved that dilemma because every time I've done it, it hasn't really worked out very well. From my experience anyway, to not do that. So I've resolved that dilemma. And the advice dilemma,
I would imagine that the advice dilemma, you would also feel a little conflicted because it might undermine the independent thinking of the client in some way, or the fear that it could.
Yes, I mean, yes, but on the other hand, when Arnold Lazarus says they rarely take it, really indicating that they have an independent part of anyway, that actually he's not taking it. So I'm more likely to say something like, well, look, if I were to advise you to do this, what would your reaction be? And if you did think it was a good idea, can you see any obstacles to actually putting that into practice and maintaining it?
Yeah.
So I mean, I do use the kind of 𝗔𝗯𝗃𝘅, or what his name is, as if method.
Yeah.
If you were to, then rather than this is what I would advise.
Yeah.
I mean, on a couple of occasions when I was asked for my advice, it was interesting by a woman brought her fiance, and they kind of spoken about this, and she said, do you think I should marry him? You see, and I think I was in this sort of period where I thought, well, let's give some advice. I said, no, I don't think I should marry him for these reasons. Anyway, she went ahead and married him and got divorced quite quickly, and she then referred me her sister on the same issue, and she came and said, should I marry him? And I said no. And she did, and now she's divorced. So,
you're a love's executioner, clearly.
Exactly. But anyway, I mean, I think that was a period of experimentation. I don't think I would have done that now necessarily. Although I think, this is the thing. If you have a view, the honest thing is to say, well, I have a view, but on the other hand, there's another aspect of me to say, look, I don't want to undermine your advice, but your sort of own thinking processes. So it's a dilemma about different aspects of being authentic.
Yeah.
I find that really.
It's a very interesting dilemma.
Yeah.
Actually, you talked about your late friend Arnold Lazarus. I remember that he also prescribed you the skill of referrals, the importance of being able to do referrals.
Yes, that's right. And I think in the later years, he would always refer some of his most difficult clients to his enemies. So,
a poison gift.
The poisoned gift, yeah.
Well, people like Ellis and Beck, and of course the people that came after them, postulated that specific cognitive strategies would be more effective in therapy. But the research seems to find equal outcomes throughout different approaches. Has this so-called Dodo bird verdict, has it puzzled you? Has it been... How do you make sense of it in a way?
Well, it's a question of actually... I mean, it's a bit like, you're looking at a person, I mean, there's a book with I love this title, which says, every person's life is worth a novel. So if you look at things from one perspective, you'll get one perspective. If you look at that same person from the top of a tall building, you'll see a little ant. So I think that the dodo bird is a question of what's the perspective. If you look at things overall, things may equal out, but if you look at things specifically, you may indicate that there are kind of different particular ways of working with people that are helpful, and different ways of working people that are not. That's why, in a sense, the kind of I go back to Albert Ellis's late 1950s statement, is that cognition, emotion, and behavior are interdependent processes. Nobody would advocate, I think, that the way to overcome a phobia is to rethink it in the session. But having some sort of attitudinal substrate in which to kind of take and to rehearse while really sort of facing up to this particular fear is actually kind of basing the therapy on that interdependent principle.
Yeah.
So I think a lot of the kind of research that kind of looks at cognition versus behavior is ignoring that interdependent, because that's what we are. You know, when I first studied psychology back in 1969, 72, we used to have chapters on emotion, learning, thinking, behavior, as if you know, people could be easily spliced up into those. We can't. We are interdependent.
Yeah.
Sort of processes, so organisms.
Yeah.
And any attempt to kind of ignore that is problematic.
You spoke about your younger years, so now I can't not make this connection. I know you made a PhD on self-disclosure, I believe.
Yeah.
So yeah. I'm going to ask you to self-disclose a little and ask you, is there any particular factor in your own practice that you know that you could have done better? I'm asking for like almost a low frustration tolerance on your part. Is there a part of you as a therapist you know you should have worked harder on?
There are some cases where I, played safe, because, and I think that, like, there's a few cases where I wasn't paid by people who were quite psychopathic, and I played safe in not really sort of following that up, and I still have two minds about that, because how these people are going to learn if people are, but I guess I kind of had this idea that life's too short, I've got too much going on in my life, and there's another, a few cases like that where I played safe, where I kind of, in a sense, wish I'd taken, more of a risk.
Okay.
And I think that is kind of about low frustration tolerance, about having an easy life, particularly when you live a busy life. Why court trouble? But I think, if you want an easy life, you don't become a therapist, really. I mean, I'm not sure that that's a good. So I do regret some of those things, and I think there was other another case that I saw where this woman was referred to me, and she had believe it or not, had sexual relationships with two previous male therapists, and I played, I was so kind of boundaried, but I was so boundaried to be useless to her. So, and I did that because, I was, I guess, frightened about, what would happen if I, so she said, oh, what's that? That's an interesting book. No, there's a hope. So, yeah, I mean, I think those are the kind of things where I've sort of failed to take a risk. I mean, for reasonable reasons, and who knows whether I would have done the same thing now, but I think that they were things that I have regretted.
But you did have a pretty busy life, let's call it. I mean, if we only look, it's a bad estimate to a busy life, but you've published, I believe, or edited more than 200 books.
250.
Ah, you're keeping count.
Nobody else does, so I should.
Well, I would like to ask you the cruel question. I remember when you interviewed Ellis, those great interviews, how were they called? In Dialogue, I believe?
Yeah.
Yeah, and I remember
Speaking, those were.
Yeah, exactly. Yeah.
Yeah.
Therapeutically speaking.
You and I were the only person to read those books.
Well, I loved both that and the Lazarus one. I never got a hold of the Norcross ones. I could only get the.
Oh, you could probably kind of pick it up on Amazon for a penny or something.
I will try. Anyway, you did this question on to Albert about of all his books, which are already quite some significant number. What was his favorite book? And he wasn't able to give an answer. Basically, he gave you like 10 favorite books. So I'm gonna try you out and do the same thing with even more books on your belt. So is there any particular book for professionals and one for the general public that you are more proud of?
For the public, I think it's the second edition of 10 Steps to Positive Living. I like that book, and it's kind of well received. I think for professionals, I would say the one that I kind of most pleased about. It's a book called How to Think and Intervene Like an REBT Therapist. And what I was trying to do there is I was trying to capture the kind of the thinking that informs the intervention, and I haven't seen that done that much. So I think if you were to kind of call me on that, I think I would probably choose those two. It's like a program called on the radio Desert Island Discs. We should call it Book Island Discs. Sort of Desert Island Books rather. And that is, take your favorite 8 books that you've written, and then if you could only save one, what would it be? And I think save the second edition of Think Your Way to Happiness. Sorry, 10 Steps to Positive Living.
10 Steps Positive Living. Yeah.
10 Steps to Positive Living. Because, I think if I was alone on a desert island, I probably need to be reminded of my wise words in case I forget them.
Your noble REBT to the rescue.
I know. Yes, go back to my roots.
Exactly.
Enough of this rubbish. Go back to my roots.
Well, the Beck style CBT, we are drawing to close, but I'd like to ask you, the Beck style CBT has dominated academic circles and institutions, and therefore having more research. Basically, they always have this academic research setting that helped them clearly. That said, are you concerned with the future of REBT?
Yes, I mean, concerned because I have a wish that REBT would be more, or the ideas of REBT would be taken more, sort of part of the mainstream. And concern is a right word because, I wish it doesn't have to be. I wish it. And, I've done my best to kind of, bring it to the mainstream. And, so, yes, but I'm pretty sure that it will still be around in a number of years. The Albert Ellis Institute is still a thriving institute and does regular trainings and workshops, and sort of few of us around to kind of still keep the flag flying. Yes, I mean I think that Ellis, while he was research minded, was never of academic research in the same way as Tim Beck was and still is.
Yeah.
One has to admire the guy tremendously at the age of in his 90s. Clarity.
Yeah, I believe it's 95.
Yeah.
Go ahead. I'm sorry.
Yeah. No. So I think, but I mean, I think that. The thing what I like about REBT is it's sort of I mean, you could look at it. I mean, there's a whole business of research and focus on a concept called distress tolerance, and that can easily be traced to the roots of REBT. And there's a whole sort of emphasis on something that's called transdiagnostic focus on processes in therapy. Well, that I mean, is that's REBT is a transdiagnostic approach to the understanding of the remediation of human suffering. So, I mean, I think that, you know, people don't form their careers by saying, I'm a follower of X. They kind of develop things, you know, and to some degree have done so without due recognition, I think, of Albert's work. And there's a book called, I think it's called Under the Influence of Albert Ellis, which, you know, people show how his ideas have predated a lot of the concepts that are current in our field. But look, you know, let me be accepting. It is what it is. I may not like it, but I can either work towards changing it, which I do in my own way. But I mean, one can't go through one's life taking well, one can, but I choose not to go through my professional life, you know, correcting everybody. I mean, I did this book called The ABCs of REBT Revisited. If you know about that book, you know that nobody. No, I spent years researching that book. Nobody's looked at it. Nobody quotes. You know, and it's. I think it's a, you know, quite an important work. But I would, because I wrote it, but nobody else done. So I'm saying yes, and let me kind of go where my heart is at the moment, and that is incorporating pluralistic and rational, flexible ideas in very brief interventions.
Yeah. Coming to a close, I'd like to finish by asking you a question I asked all of our colleagues in these interviews, and that is, what advice... Oh, coming back to your dilemma, by the way, the advice one. So,
yeah,
what advice would you wish to have received when you were starting out as a psychotherapist?
Maybe I should have listened to my father. He said, son, you know, I want you to become a lawyer. There's only two kinds of lawyers, rich ones and millionaires. He said, no, I'm like a therapist. No, I mean, other than that, I think that what advice would I have wished? I mean, I think in a way is really to kind of be true to your ideas rather than, you know, to seek out. And I think I have been sort of true to my ideas. I mean, I am still an REBT therapist in my foundations, but I draw upon a whole host of other things. So that's true to my ideas. I've tried to kind of, you know, write and promulgate REBT from a flexible and sort of idiosyncratic idea. That's the idea. So I don't. Nobody said to me, "Be true to your idea." So I think I probably advised myself by the way I have actually gone about things, and I think I haven't done too bad a job. Hopefully,
for sure. So,
okay,
Windy, thank you so much for this opportunity.
My pleasure, and keep on inviting the old, the great, and the good.